Hello, my name is Marcia Boyle. I'm the president and founder of the Immune Deficiency Foundation, which is the national patient organization dedicated to improving the diagnosis, treatment, and quality of life of the primary immune deficiency diseases. I started the foundation in many ways because I found out my son has one of these disorders, and there was no organization. I have a library degree. One of the first things I did was do my homework. What's out there? There were no educational materials. There was no organization. There was no mechanism to put patients together. I think one of the most important factors for me is we all think that there's somebody out there that's going to help make a difference, that's taking care of whatever our problems are. And there was no organization that would advocate for my son or individuals like my son. I perhaps didn't anticipate some of the issues, but I knew he had a rare chronic disorder. I knew health insurance could be an issue, and I wanted to make sure that there was an organization advocating and really watching the back of this patient population. And that motivated me to reach out to physicians, to find other patients, and to ultimately start the organization and to stick with it. Well, we're dedicated to improving the diagnosis, the treatment, and quality of life of people with primary immune deficiency diseases through advocacy, education, and research. And again, we are a patient organization. We've been very focused from the beginning on education. We developed the first educational materials in the world for patients and families. And to this day, our materials are used around the world. I can't even tell you how many different languages some of our materials have been translated into. We put on educational meetings around the country. Every other year, we have a biennial national conference. 2015, over 1,300 people came. We have a teen program. We have teen retreats. We just everything we can do to educate our patients and families. We also do physician education because, frankly, how are our patients going to be treated? If they won't be treated well if the physicians don't know about them. The primary immune deficiency diseases are a group of really over 250 rare disorders of the immune system. One of the biggest problems is because they are so rare, physicians and the general public are not aware of these disorders. So when a child, and you can have an adult as well, there's adult onset, common variable immune deficiency can happen in any decade of life. Someone is having repeated infections, unusual infections, serious infections that just won't clear up or keep coming back or recurrent. One should raise the question, is something else going on underneath? And ask for more testing. Do I have immunoglobulins? Are they functioning properly? Or if there is a suspicion of a primary immune deficiency, to be asked to be sent to an immunologist to do a more thorough workup to get down to what really is going on, because some of them can be quite complex. But again, unusual, serious, recurring infections are a sign that something else is going on here, and just treating the symptoms is not enough, and there is an underlying problem, and many of the underlying primary immune deficiency diseases can be treated effectively. Well, again, in the beginning, it really was education, how to reach out. Now, these were the days before the internet, and how to reach out to physicians, how to make patients aware that we were here, and we had resources for them, and we had ways of connecting them with other people. But then you want to solve some of the problems. A lot of insurance problems through the years. Our patients have chronic, lifelong conditions. They have expensive therapies, and whatever way you cut it, insurance is going to be an issue. So we have turned a lot of our efforts not only into education, but advocacy. Not only advocacy for the individual, working with them when they're having health insurance issues or access to care issues, but also working on Capitol Hill. About 4 years ago, we were very fortunate to actually get a bill through Congress, both sides of Congress. It was amazing, and the Medicare IVIG Access Act. But we've been very involved in working and networking with other groups in the implementation of the ACA and any issues that could impact the health and well-being and safety of our patients. We get involved in at the federal level and where we can at the state levels as well. These are a group of rare disorders, and many physicians have not really known about these disorders. So getting the patient diagnosed and then getting access to a specialist and access to appropriate care, and then very importantly, being able to afford this care. With a lot of changes going on in health insurance, the ACA, some of it good, some of it, challenging. Some of our patients are having issues. They may have insurance, but they can't afford their co-pays, the co-insurance. There's been more cost shifting to the patient, and for an individual with a chronic condition, that can mean the difference between being able to afford your therapy or not afford your therapy. Some insurers are creating specialized formularies that make it difficult for some patients to get the particular brand of immunoglobulin, for instance, that they really want, that they do well with. And, it's just going out of network can be very expensive, and some patients have insurance that you have to go out of network to see a true specialist, and to see a true specialist means you're getting the best care. So there are a lot of challenges out there. Well, we've been watching the Cadillac Tax for a while and very concerned because about 2/3 of our patients actually receive their care or their insurance through employer-based plans. And those patients who have good insurance have fewer problems in terms of accessing specialists, affording their care, and the best care possible. So anything that would be a tax on employer plans was a concern to us. And the more we heard it, and then we looked internally and realized this year that the Immune Deficiency Foundation's own plan, and we have a good plan, but it's certainly not what you would call a Cadillac plan. There's a deductible with it and everything. Already 3 of our employees would be subject to it, so the foundation would pay for it. And if they were looking at our plan as a Cadillac plan, most of our patients were really in trouble because our patients go for employment where they can get good insurance. We heard a lot of the arguments about the Cadillac tax, and none seemed to focus on the issues of a patient with a chronic condition, that every year they're going to have high out-of-pocket. Every year they're going to have very expensive therapy. So we actually joined the fray and came out wanting the Cadillac tax repealed. And I testified, we wrote some editorials, and very few patient organizations were doing that because they were afraid, would that mean you're against the ACA? We are very much in favor of the ACA, but we're very much against a Cadillac tax or paying anything that would be detrimental to the health of patients with chronic diseases. So we were pleased to see that it has been postponed for 2 years because many employers are already changing their plans in anticipation of the implementation of the Cadillac tax, because what employer can afford 40% tax on their health insurance? And from studies I've seen, about 20% of employers have made some changes. And these changes mean fewer benefits, more cost shifting to the patient. So we're hoping very much that the Cadillac tax will be repealed, and the vote of like 90% of the Senate was opposed to the Cadillac tax, and many presidential candidates are opposed to the Cadillac tax. So we're in very good company.